You can hear me clearly. Welcome to our next session at the Global Digital Health Summit. My name is Ugochi Ejogu, and I am the Secretary and Community Engagement Co-Chair of the Anna Beatrice Society. In honor of Women's History Month, we are highlighting 4 outstanding women in the field of digital health. We are very excited to welcome these thought leaders and innovators into our space to share their experiences, strategies, and visions for the future of global digital health leadership. So as a member of a woman-powered student society at Bloomberg, it is my pleasure to introduce our panelists for today. So first we have Sherry Haas, who is a seasoned digital health and health systems policy expert with over 15 years of experience in program development, project leadership, health system strengthening, and technology solutions. Her expertise spans user-centered digital health and digital financial solutions, qualitative and quantitative research, and data-driven decision-making. As a senior digital health systems advisor at USAID's Global Health Bureau's Office of Health Systems, she contributes to multiple digital health networks and technical working groups, including those focused on gender equity, diversity, and inclusion. Ms. Haas holds a Master of Public Policy from Duke University and a bachelor's in economics and political science. Next, we have Carol Kamasaka, who is a highly accomplished digital health specialist with over 10 years of experience leading the design, implementation, and evaluation of digital health interventions across Uganda and sub-Saharan Africa. She has collaborated with major donors like USAID, World Health Organization, and the Gates Foundation to deploy tailored solutions at national and subnational levels. Currently the Senior Program Officer of Digital Health at PATH Uganda and President of the Uganda Health Informatics Association, Ms. Kamasaka advises on digital health strategies and initiatives. Her extensive experience spans engagements at national and subnational levels, working closely with the Ministry of Health and providing guidances on SOPs, training, monitoring, and insights. Holding a bachelor's in information technology and a master's in health informatics from Makerere University in Uganda, Ms. Kamasaka drives positive change through effective utilization of technology for improved healthcare access and outcomes. Next, we have Emily Nicholson. Ms. Nicholson is a digital health expert passionate about user-centered software and programs. She has led the development of open-source digital health global goods used during disease outbreaks. Emily has also designed, implemented, and managed projects focused on digital governance, health system strengthening, interoperability, and data use across Africa, Latin America, and the Caribbean. Currently UNICEF's Regional Digital Health Specialist for Latin America and the Caribbean, she provides technical assistance to country offices and ministries of health. Ms. Nicholson holds a Master of Public Health and a bachelor's in Latin American Studies and political science from UNC Chapel Hill. She is a member of the Digital Square Peer Review Committee, the 2023 Women Lived Health Cohort, and a returned Peace Corps volunteer, as well as a proud mom of 3 teenagers. Thank you for including that fact. And lastly, we have Dr. Olivia Velez. Dr. Olivia Velez is a health informaticist and global digital leader serving as Director of Technical Services at PATH. She oversees digital health and data science initiatives aimed at advancing global health and reducing health inequities. As co-chair emeritus of the Global Digital Health Network, Velez guides the Women's Leadership Workshop and supports the Global Digital Health Forums planning. Driven by the potential of digital tools to strengthen health systems and empower the workforce, she champions digital transformation in global health. Dr. Velez holds a PhD in nursing informatics from Columbia University. So please join me again in welcoming our esteemed guests.
Thank you, Gopi, for making the introduction. I'd like to thank all of our panelists for making the time for this session. We're very excited to engage with you and have the opportunity to learn. I'd like to begin by posing a question to all of our panelists here. We have a very diverse student body here at Hopkins with very varying degrees of expertise in digital health. So to start us off, could you share maybe a brief introduction and provide an overview of some of the digital health initiatives that you've led? We could maybe start with Dr. Olivia.
Sure. My initial training was in computer science and neuroscience. And so I started working in the US domestically on projects with community health centers, doing tracking for HIV patients and care, and lost to follow-up. And I did that for quite some time before I decided to go to nursing school because I thought I would design better tools for nurses if I was a nurse. So that's how I ended up in nursing school and getting my PhD. And from there, I started working on a number of different large USAID projects, UN projects, in a whole bunch of different areas, like different disease states or maternal child health. So I've gotten a chance to work mostly on every every type of clinical background that you can imagine. I think in part because I have such a diverse background, it's kind of easy to stick me in anywhere with a project. And I think I just recently joined PATH, so I can't say much about the work there, but I have worked in the past couple of years on global goods. And so looking at digital public infrastructure tools such as IRIS, which is a health workforce registry that I did as part of my job at IntraHealth, to track health workers, ensure that we get health workers in the right places, and try to address things like burnout and training needs and that sort of work. So yeah, that's my introduction.
Thank you so much. Maybe we can have Dr. Sherry Hass, if you could share a little bit about your work in the digital space.
Hi, sure, thanks. As noted, I have a background in economics, research and evaluation. I did my master's in public policy with a focus on health and quantitative research. I currently serve as the Senior Digital Health Systems Advisor through contract within USAID's Office of Health Systems and have been in this role for about 3 years. So some of what I support now, I'm a technical advisor on the management teams of some of our digital health focused global projects. So global projects, global mechanisms are what we refer to as the ones that are awarded and managed out of USAID's headquarters, and then they can be used by country offices throughout the world by what we call buy-ins to the project. So I support some of the management and implementation and then technical leadership around digital health and digital financial services for health. Prior to this, I worked in a couple of the implementing partner organizations, including Management Sciences for Health and APT Associates, and have supported research and evaluation and implementation of digital health and digital financial services, or what we used to just call mHealth and mobile money research and implementation. So a lot of my background has been on development research and economics and evaluation, rather than focusing specifically on health. For example, I'm not an MD or a MPH, for example. Thanks.
Thank you so much. Maybe Ms. Kamasaka, if you would like to go ahead.
Thank you so much, Katia, and thanks for having me. Like earlier introduced, I'm Carol Kamasaka, currently working with PATH in Uganda as a Senior Program Officer, Digital Health. I'm also newly into PATH, about 9 months, but I'm also the founder and the president of the Uganda Health Informatics Association, which is an upcoming association of health informatics specialists. My background is in information technology. I also did a master's in health informatics to strengthen really my technology skills within the health sector. Previously worked with Ministry of Health. Most of my actually informatics career was with the Ministry of Health. And I'm happy to say that 10 years ago when Ministry of Health introduced information systems, I was there. So I saw this journey of digital health unfold within Uganda and other countries in East Africa like Kenya and Tanzania. And I've led major initiatives, including development of SOPs for implementation of digital health solutions, development of guidelines and strategies around implementation of digital health. But my two key initiatives that I led, and I look back and feel like, yeah, I was there, I did this, and it has had an impact. One was the introduction of the capacity building program for health workers in ICT, because I did notice that there's really a pain while these solutions are introduced in boardrooms and with highly technical minds. The people that are implementing them have the least of knowledge about even the hardware on which they sit. So I did introduce this program for health workers to be trained in basic ICT skills and a little bit of informatics to quicken their adoption of these digital tools and their use. And it has really had a major impact. A curriculum was developed. I developed training materials and a strategic plan of building the skills of these health workers, and at all levels, including the community health workers. The other major achievement and initiative that I led was the introduction of the electronic community health information system, initially being implemented by partners in the private sector and for profit, some of them, and being built on one platform, the Community Health Toolkit. I did lead the coordination of these partners and harmonization of their platforms into one tool, which is the electronic community health information system, but also introduced it in the public sector. And this worked out very well. And currently it's being rolled out at a large scale in Uganda. And the major funding through my resource mobilization was from the Global Fund and Rockefeller. Yeah, thank you.
Thank you so much. Ms. Nicholson, if you could share a little bit about your work in the digital space.
Sure, thank you. And thank you, Katya, for having us all here. It's exciting to be with these wonderful women whom I call friends. People talk about careers being either a ladder or a jungle gym, and I am definitely of the jungle gym. I'm team jungle gym. I started out in Latin American studies, and right after college moved to Japan and taught English, so switched entirely. Then wanted to go back to Latin America, and as noted, I was a Peace Corps volunteer in Bolivia. After that, I had some kids and then decided to go to law school. Didn't like law school and decided to get my MPH. So all of that to say, you can do whatever you want and do what feels good, because believe in yourselves. After my MPH, I started working in Africa. Had no experience in Africa, had no experience in digital health. And that's where I cut my teeth in digital health. I was part of the team that deployed mHero, which was a SMS-based system for connecting health workers to the ministries of health in Guinea, Sierra Leone, and Liberia. I worked there for a while as part of the IntraHealth team. Olivia and I have not yet worked at the same organization, but sort of follow each other around in various ways. And so then at IntraHealth, I helped build several different open source global goods. I helped with the building of mHero and also Gopher, which is a facility registry. It's the global open facility registry. And then I also helped with a lot of the IRIS work and the IRIS mHero integration. I was really fortunate at IntraHealth to be able to go both deep and wide with my work. So while I was building those systems, I was able to implement OpenMRS on the ground in South Sudan, but then also be a part of the DATM conversations. So the backside of PEPFAR, what are the systems that the US government has been building in support of the PEPFAR implementations in various countries. So I could see where US government thinking was going around digital health, but then also understand what it was like to be at Juba Teaching Hospital rolling out a tool with female health workers who hadn't seen anything similar previously. After IntraHealth, I moved over to Palladium, and I spent about 2 years there on a variety of different projects, including DataFi, where we worked to develop situation rooms for PEPFAR data analysis. So this was really different for me. It was using the data in the systems as opposed to building the systems through which the data flows. And then I switched over to UNICEF about 2 years ago, and now I'm back in Latin America. I miss Africa and all my African colleagues and connections, but pivoting back to where I began many years ago in Latin America and working with all of the countries in the region from Haiti to Argentina and everywhere in between to support UNICEF country offices with the digital transformation of our health programming.
Thank you so much. I think it's wonderful that we have like panelists from very diverse experiences, and we have the opportunity to learn from your journeys. Bringing me to my next question, we understand that leading transformative change in health systems requires a blend of vision, persistence, and the ability to execute. So could you provide some insights into your leadership philosophy and the strategies for driving innovation while navigating the complexities of the healthcare ecosystem? Maybe Dr. Hass, if you would like to start.
Hi, thanks. So I think if I just kind of pick one quality or one thought here, one of the most important things I think is to always try to start with a learning perspective. So ensuring that the work you're doing or supporting is engaging the full range of individuals who will be involved or potentially affected by the work. Really planning for enough time to ask questions and listen to the answers and work collaboratively throughout. I think you should always expect that plan A, have a plan A, but it's probably not going to be the one you end up going with. You might run through plans B, C, and D, and being able to really continue to learn and adapt as you go, I think is essential both for the work and as well as, coming in with that perspective, being flexible in how you work and not trying to hold too tightly to your original plan or your original idea, so that you're really understanding the context in which you're working, the health systems challenges that you're trying to address, and making sure that the work that you're doing ends up leading towards those goals.
Thank you so much. Ms. Kawasaka, if you'd like to share a little bit about what your strategy has been as a leader in the digital health space.
Thanks, Katya. Three things: resilience, patience, and empathy. The digital transformation journey is quite broad, and it requires a lot of patience, and it requires a lot of understanding of our clients. And our clients, in this case, I'm looking at the health workers, and being able to understand their needs and their pain points in adopting this technology, and the health workers at all levels being able to understand how well they know or how well they perceive technology, or not even perceive this technology, or not even understand it at all. So those have been my three core principles, and being empathetic and really putting myself in the shoes of these health workers and what they go through in trying to adopt this technology, what they need to actually adopt it quicker, and customizing their needs and solutions for them to ensure that they really understand and are able to use this technology without leaving them behind and saying, you're at this level, we can't go with you, we have to leave you behind and go with those who know. Those have been really my core principles. Thank you.
Thank you. Ms. Nicholson, if maybe you'd like to share a little bit about what your strategy has been.
Sure, thank you. I always think about the parable from India of the blind man touching the elephant. To recap quickly for those of you who might not be familiar with this, it's about a group of blind men all attempting to describe and understand what an elephant is, each touching a different part and disagreeing on their findings. So someone touches the trunk and it's a snake, or a leg and it's a tree. And that's how I think about digital health. All of us are touching different pieces of this large, big, amorphous change system, ecosystem. And we're all seeing only our part of that big whole. And so I think it's exceedingly important as leaders that we stop and recognize this. And Carol alluded to this, we need to perceive our pain points and pressures are not the same as those of the female frontline health worker, nor of her supervisor. So that being said, my philosophy for leading transformative change really centers on listening, asking precise and directive questions, and then listening again, right? It's a cycle of just learning and growing to understand all of the actors on the data value chain, from the developers to the mothers who are eager or afraid to vaccinate their children.
Thank you for sharing that. We come to Dr. Weathers a little bit maybe about what your leadership philosophy has been in this space.
Sure. So I kind of aligned with what the others have said so far. It's like really like, knowing my reasoning, what my why is on whether it's for a specific project or overall in my career. And then also with the people I'm working with, whether it's a frontline health worker or a donor or another implementing partner, what's the motivation for whatever the project is, and how does that impact what the processes are going to be, what the inputs are. I think being aware of that is really important. As you can see just from this panel, you're always working with a really diverse set of backgrounds and interests and priorities when you're trying to do any kind of digital health project, and trying to align those values and kind of getting everybody on the same page is what helps things to be successful. So being open, listening, understanding, trying to figure out where everyone who's coming to the table is and where they're coming from is really important. So just having an opening, listening, learning mind, I think is really a critical skill to have as a leader in this space.
Thank you so much. So we understand that implementing such large-scale interventions often requires extensive collaboration and support from several stakeholders, like you mentioned. So maybe you could share a little bit about how you approach the challenge of aligning these diverse interests when you're rolling out digital health solutions, and what advice would you have for aspiring digital health leaders in addressing the issues that come with this? Dr. Ellis, if you would like to share.
Oh, sorry, were you starting with me again? Sure. So I think, my philosophy is, again, just like when you're working on a broad team, is to, take the time to get to know people and what their values are and what their interests are. I think this field is as much about networking and cultivating relationships as anything else. I think there's a few times we've gotten together in large groups, and we've always talked about the biggest challenge in digital health is people interoperability, and not any other kind of technical challenge. So how do we achieve, people interoperability, is, again, I think, getting to know, what's the government's desire? What do they want? What are they trying to accomplish? What does the health worker need? Like, how's you're coming in, you're bringing in this project, is it just going to be another burden on them? How are you going to make it helpful to them? How am I going to talk to this mobile network operator? And, it's not just going to be, some funding drain on them, right? Like, they need to make money to stay in business. And so how do we get that into the project? So, what is the donor's perspective? What do they have to report back to their taxpayers or whoever they need to report back to? So I think, understanding all those perspectives, and then at the end of the day, really looking at, is this going to change health? Is it going to have a positive impact on health? And having that be the golden ring you're all reaching for is really important.
Thank you so much. I think people interoperability is a wonderful term that we'll be taking away from this session. Maybe Ms. Hass, if you would like to share what advice you would have for aspiring digital health leaders to deal with issues that come with the diverse stakeholders we collaborate with.
Sure, thanks. And I think as Olivia said, really thinking through the fact that you have a lot of perspectives, you have a lot of interests, you have a lot of goals. I think especially in the digital health space, maybe more so than in a lot of the other kind of health areas, you can expect to work with people outside of the health area. You have a much broader range of interested and potentially engaged stakeholders. So that might mean Ministry of Finance, that might mean, depending on where you're working, Ministry of ICT or e-government, offices of the country's executive branch. Some countries kind of lead digital transformation initiatives out of the president's office, for example. So it really kind of depends where and how you're working, what all your stakeholder map needs to look like. And, always, even within a lot of these contexts, you're going to have people who have different goals and different responsibilities and different things within their job description that they need to focus on. You'll also have a range of private sector organizations, as Olivia mentioned as well. What is the goal of a mobile network operator in being involved in a particular program, and how do you make it relevant to their work as well? So I think really, understanding the networks that you're working within, going back again to listening and understanding and asking the right questions and getting early engagement. I think you don't want to get a year into planning and implementation and then realize, oh, hey, now we need to reach out to the mobile network operator and ask them to please, provide us all of these services for free or something like that. Getting early engagement is really key, and kind of building their interest in the work as well.
Thank you so much. Ms. Kamasaka, if you'd like to share some advice for aspiring digital health leaders.
I think first things first, the national priorities should be first, because once you understand the national priorities, then you're able to align different stakeholders' interests and priorities to the national priorities. And you sort of have a bucket where you put the shared goals, the shared interests, and have clear and consistent communication to all these stakeholders. And these stakeholders can include even the policymakers, and making sure you do not leave out any stakeholder, no matter how small they are. Never leave out any stakeholder in implementing these solutions, because every stakeholder at every level matters. Then the other thing I've learned is building and keeping networks is really, really key in implementation of these solutions, but also in the bigger ecosystem of digital health. You build those relationships, you keep them, but also going out of the way to understand the healthcare ecosystem, to understand the technology system, and also this helps you a long way to navigate and align all the interests of the stakeholders. Once you understand the ecosystem, you're able to navigate even the challenges that come along with different stakeholders, different interests, different priorities. Thank you.
Thank you. Ms. Nicholson, some advice for aspiring digital leaders that we have with us here today?
Yes, so I'm pleased to know that my colleagues and friends have said a lot of what I was going to say, which makes me think we're all rowing in the same direction, which is phenomenal. I would say communicate early and often. Not communicating with your stakeholders or not communicating with them in a way that makes sense for them can be difficult. Sometimes that means you have to take a technical document and translate it into a user story or something that can relate to that stakeholder, where they are and how it affects their job. I think that's quite important. There are a plethora of documents in the stratosphere on digital health and how to implement digital health. There are guidance documents from USAID, from WHO, from PAHO, from UNICEF, all sorts of really great documents. So you never have to start from scratch, right? So read, research, build on what's out there. I think that's another thing I would share. And then going back to what Olivia said at the beginning about human interoperability, it's so true, because it's interoperability between countries and regions, between donors and implementing partners, between HQ and field offices, even between staff on the same team. There's so many layers of that human interoperability. And we all know that assuming things is negative and dangerous for all of us, but I think we can turn some of that on its head and Carol had mentioned before, assuming a position of empathy, right? If we walk into a room and we assume a position of empathy, I'm here to listen, I'm here to learn, and then I can provide technical guidance or experience. I think that's been quite helpful. And I think also assuming positive intent. Every one of us in this space is really working to actualize our vision for a more just and equitable world, particularly when it comes to how health services and systems reach the most vulnerable among us. And so if we enter conversations with stakeholders, even if they're grumpy, and recognize that we're all here because we are all essentially wanting to move the world in the same positive direction, I think that's helpful. And it's hard, sometimes it's tough, sometimes you get doors slammed in your face, but if you keep going, another door will open.
Thank you so much for sharing that. So like networking and engaging partners early and having an understanding of national priorities are important when we're trying to work in the digital health space. So what would you say have been some of your personal qualities or habits that have been instrumental in your success in the digital health field? Maybe we can have Ms. Kamasaka share a little bit about that.
I would say resilience. I know I'm so resilient. I've been really resilient. And when you're resilient, you'll conquer every challenge. You'll be able to persevere no matter the challenges. And I mean, our field is majorly male dominated, but you've got to be up there and stand your ground and stick to it and face all these challenges head on. And then you have to be willing to unlearn some things and then relearn, continuous learning, because technology is evolving. The things I studied 10 years ago, 15 years ago at university, probably no longer in use right now. We're studying HTML, we're using Java, but right now we are talking Python, we are talking R. So you have to be able to learn and unlearn and relearn to be able to cope with the new. And then the other thing is adaptability. When you're able to adapt to these changing technologies that evolve every day and night, you're also able to respond to every change that comes with it. And through that, you're able to form new strategies and build new strategies to keep going in this field. Thank you.
Thank you so much for sharing that with us. Ms. Wells, maybe a little bit about what some of the personal qualities or habits have been that you think have been instrumental in your success in the digital health space?
Sure. So like Carol said, being open to learning is really important. This is a rapidly changing field, and you need to be able to keep up with all the changes in technology. It doesn't mean you need to know every programming language. It doesn't mean, all of that, but you have to be able to speak with it. You have to be able to understand, like if you're managing a team, what technologies they need to use, what tools they need to use. So being able to stay up to date on all that kind of information, and then maybe also like the policy around it, the ethics around it. I think especially now as we talk about AI and responsible ethics, understanding what those issues are is critically important. If you're gonna work for an implementing partner, you need marketing skills, which is something that I've learned. I'm not a business person, but a big part of my job is marketing, and being able to showcase what my organization can do, what skills we have, why we would be the best implementing partner for a particular project, and a lot of that is it's really marketing, and I've had to take the time to learn that and understand what goes into good storytelling about a project and about or about an intervention, and why USAID should invest in that, why we should direct resources to X instead of Y. So I think being aware of all those different skills is really important. A soft skill, good networking. I mean, this panel is great because we're all connected on WhatsApp and LinkedIn and have like, I don't know, 20 different overlaps at different times. And, being able to call on people and say, hey, Carol, do you want to run for co-chair of the Global Digital Health Network? Because we need someone to take my place. It's so much easier to do when you've built relationships with people. And, I think especially for us as women, being able to advocate for each other in a male-dominated space has been important, to make sure that we're in the leadership roles and that our voices are getting heard. So yeah, diverse skills is always really important.
Thank you so much. Ms. Hass, if you would like to share a little bit about what some skills have been useful to you to work in the digital health space.
Sure, thank you. And I would echo what Carol and Olivia have both shared already. I think early on in my career, and I was not in the digital health space, early on, it didn't exist at that point. It's not a term that we used then, but I think just showing my interest in really growing my skills, being supportive on whatever activities I was doing early in my career, constantly wanting to learn more. I think that helped me build relationships with colleagues and allowed them to feel like they could count on me and could count on my work, and so would continue to give me more and different opportunities and ask me what I was interested in and what I would like to try to do. So being, even if something wasn't necessarily quite in my line of field, like being able to continue to work to build that network, not for the sake of networking, but for the sake of building these relationships, becoming known as someone that they could count on and whose work they could count on. Just adding numbers to my LinkedIn profile isn't what's going to do it. I think it's the relationships with people who really know me and have known my work that have mattered the most. I started off at a small organization, so that allowed me to get a wider range of both technical and operational experience. So working across project management, finance, development, which connects to the marketing skills that Olivia was mentioning. I think also really being able to both speak and write concisely to be able to get your point across. Quality writing skills are always in demand, regardless of what you're looking to do. I wouldn't downplay as well, quality. It's not a quality or a habit, but the role of chance also certainly has had a role in my success and in my career path. Being willing to try new things as they come up, even if it wasn't necessarily in some kind of grand master plan that I had originally, but being able to be flexible and try new things and find new paths has been wonderful as well.
Thank you for sharing that with us. And I'd like to bridge it to the next question while Ms. Nicholson answers that, as to what some skills have been useful to you in the field and what advice you'd have to the graduate students here when they're trying to position themselves for a career in this space and aspiring to be digital leaders like yourself.
Thanks. Would you like me to skip to that question or answer the first question?
Maybe we could take both.
Okay, perfect. Well, I would agree with everything that my esteemed colleagues said. So I'm just going to dig into that a little bit. Persuasive writing and being able to distill really complex topics down into decisions. So there's a lot of swirl with all of these stakeholders, all of these systems, all of these opinions. How can you take all of that and put it into a pretty short email and bring it to your leaders and say, these are the decision points, A or B, right? So that takes a long time to process all of that, but I think that's a skill that's really important. I would say also, really foster your academic curiosity. I think Sherry said this just a moment ago. And if you have a question, don't stop digging until you find the answer. And if you don't find the answer, then maybe that's your answer. Maybe you're the first person to surface that question. When I first started in my career, I talked to a colleague, an esteemed global health practitioner, and I told him, I don't really know what I'm doing. And he said, Emily, nobody does. we're all just making it up as we go along. We're learning and evolving. And that was so liberating to me because I realized I don't have to have all the answers. And even if I have the wrong answer, someone's going to help me get to the right answer. So I think that leads me into my next point is we are a big global team. It's really not a coincidence that the four of us already knew each other and have already worked together, because that's the way the field of global health is. It's big, but it's also small. And you're not alone. There are practitioners, aficionados, implementers, donors, technologists. All of us are really working together and sometimes bumbling along. But I do believe we're generally rowing in that same direction towards the goal of equitable, transformative health systems. So lean in on your colleagues, ask for help, but be willing to support them and provide that help back to them. I think those are some things I would say. Relationships, academic curiosity, don't stop, and don't give up.
Thank you so much. Ms. Kamasaka, if you'd like to share a little advice for our students in the audience who are positioning themselves to be leaders in the digital health space.
One, I think I'll go back to what Ms. Haas said about not downplaying, and I think Olivia also alluded to this, not downplaying the soft skills. You have those interpersonal skills. I mean, you'll need these people. How you talk to them, what you talk to them about really matters. Then networking really plays a big role. And Emily just mentioned, we have known each other for a very long time because we are in a global space, but it is too small. But we have networked, we have worked together, and it's a call away right now. If I need something from Emily, from Olivia, network, attend these events. There are very many digital health events globally, regionally, and connect with other professionals. Be a member of a digital health community, either at the regional level or at the global level, but make sure you be a member of a community of digital health. There's a lot to learn. There's lots of people to meet. There's lots of network opportunities. So make sure you become a member of any of those digital health communities. And we hope that our paths will cross, and we'll meet you, and we'll be happy to embrace you. We'll be happy to have you and share everything with you. Thank you very much.
Thank you so much. Ms. Fellis, if you'd like to share a bit about advice for the students here.
Yes, I'll second what Carol said. You know, start attending conferences and networking, see you know, what work is being done now, what's being implemented, what people are talking about doing in the future, and that'll give you an idea of what skill sets are needed and what projects are going to be up and coming, what things people are interested in implementing. But yeah, and again, you know, not to don't forget your soft skills as you're working on technical skills. I agree with others, you know, writing is very important, being able to communicate, being able to present. You know, as someone who oversees a dev team, I love nothing more than when my devs are good at customer service, you know, so it makes my job easier because you know how to talk to our clients directly. So, you know, being able to communicate with whatever stakeholders you're working with is really important. And then, you know, this is a really cool field and you should be excited. You know, we're doing work that's hopefully making a difference and impacting people's lives. And, you know, we'll start to really hit on goals like, you know, ending HIV and, you know, rolling out a malaria vaccine and getting all these things into place. And it's really exciting. So, you know, I encourage you to you know, use your passion where you think it might be best suited.
Thank you so much. Ms. Has any words for our students?
Sure, thank you. Well, I think my colleagues here have really touched on a lot of that. I would just say, you know, this is a growing space. It's a growing field. You know, a couple years ago, if we were all talking together, it would all be about blockchain. And now it's all about AI. And we don't know what it's going to be in 5 years. So just keep learning, keep being flexible. There's a wide variety of skills needed, and you don't have to have all of them. You don't have to be the Python programmer and the AI expert and the person going out to do the kind of requirements gathering and relationship building. So focus on the things that are of interest to you, kind of be willing to continue to grow those skills, but don't feel like just because we've mentioned all of these things, you need to be all of them in one. Thanks.
Thank you. I think that was a very wonderful takeaway for our students. And I think the summit was organized so that our students get an opportunity to network and learn from leaders like you. I just open it for any questions for our panelists from the audience or from the online audience.
I have one.
Okay.
Hey, I wanted to ask, when you need help, who do you look for? What type of professional or guidance?
Would someone like to answer the question?
I can take that just to start. It really depends on the problem I'm trying to solve. If it's a technical problem, then I speak to my software development friends or my friends who are very technical. If it's a governance problem, I look to my colleagues who have done a lot of work with governance and health system strengthening. I think, one of the benefits of having worked at several different organizations is that, I have colleagues and former colleagues in lots of different places. And I don't know, probably 15 different WhatsApp chats of digital health implementers. And there are chats where people just post questions. Actually, Olivia and I were chatting on one of those chats this morning. It's 100 people from all over the world, and someone asked a question and people answer. So I guess I would say certain questions, people I know really well. Other questions, just I throw it out on the chat and someone always answers.
Thank you so much. I think we had a question from someone online. I'll just wait for them to post it in the chat. This one.
They raise their hands, so ask them to unmute.
I don't think they can unmute. You should be able to unmute and ask your question now.
Maybe the chat.
Okay. We have one question. So the question is that if someone wants to participate in digital health, what would you suggest for someone who's just beginning and exploring the space, and what are some technical skills that every public health student would need if they were interested in exploring the digital health space? If someone would like to answer that question.
Sure, I can go, though I think my answer is a little biased. But honestly, if I was gonna start again right now, I would focus on data science and machine learning. I think, understanding how data needs to flow within a health information system, like at the national level or even just at a clinic or a hospital, what you can do with that data, how you can, use it for predictive analytics or for, behavior change or anything like that is really powerful and is going to drive a lot of our work in the future. And I think, as a public health student, you're probably in the very right place to pick up those skills. I'm sure there's cross courses you can take to learn. It's really easy nowadays to go online and get access to data sets so that you can start playing around with modeling and even teach yourself if it's not a part of school, and just build a portfolio so that when you go apply for a job, you can say, here's how I would solve this problem. And the person interviewing you can be like, wow, they have a nice portfolio of work. So that's what I would do. But like we were saying earlier, that you should do what you feel most interested in, because we do need people from so many different disciplines to really make these projects work and make them successful. I'm just flexing my data nerd skills and saying that that's what I would want to do.
I think if I can add on to what Olivier was just sharing, even if you aren't working specifically in the digital health space, this work is going to impact everything that's happening in health in general. So one of our colleagues, I remember a couple of years ago, started saying, it's not digital health, it's just health. All of health is going to interact more and more with the digital space. And understanding some of what's going on in here, what's possible, what the future looks like, regardless of where you're working in the public health space, is going to be important. To the data side as well, the data use piece. So I think we've been trying to get more and more out of just a data for reporting, collecting data and sending it up the line, and much more into a space where we're saying, okay, who has the ability to make decisions and what information do they need to be able to make those decisions well? How do you ask the right questions of the data? How do you think about how we can be using this information to make it more informed choices at whatever level of the healthcare system and in whatever space you're working in? Thanks.
Thank you.
I might add
Ms.
just-
Nicholson, yeah.
Sure,
Please
just
go
two
ahead.
quick things. Taking it in a little bit slightly different direction. I think monitoring and evaluation skills are really important. What is the impact of this digital solution? What is the impact that I'm hoping to see? Did I actually get there? Understanding all of that and how to do that is really important. And then hearkening back to some of the things Carol and I were saying about frontline health workers, change management. How are we respectfully meeting people where they are to introduce digital skills? How are we changing these health systems from the bottom up, not just from the top down, so that systems and devices aren't rejected, but rather are embraced?
Thank you so much. And thank you to all the panelists for making time to attend this session. We had a wonderful time engaging with you and to have the opportunity to learn from you. And we hope to engage with you in further discussions in the future. Thank you so much.
Thank you too.
Thank you all. Thanks for having us.
Thank you all
Bye.
for having us.
Thank you all. Bye.